Here are the answers to the quick pathology quiz. The first case was a 60-year-old with a lump at the angle of the jaw, and this is a benign tumour of the parotid gland called a Warthin tumour or adenolymphoma. The link to the video about Warthin tumour is above. The second case was a patient with multiple cysts on the chest, and this is a nice example of Steatocystoma. The link to the video about Steatocystoma is above. This is a bladder biopsy from a patient with urinary frequency dysuria and terminal hematuria, and this is a good example of Schistosomiasis. The link to the video about Schistosomiasis is above. This piece of small bowel from a child with abdominal pain and symptoms of bowel obstruction is a nice example of Intussusception. The link to the video about Intussusception is above. This hard, slow-growing lump in the skin of the neck of a child is probably my all-time favourite pathological lesion, and it is a Pilomatricoma or calcifying epithelioma of Malherbe. The link to the video about pilomatricomas is above.